We are all set on this side.
Back on my head, the camera.
So like. Nowhere to see me, and we can see.
What?
And.
On the warehouse or? All right, thank you so much, everyone coming to the Pathway to End Gun Violence Advisory Council. I know we haven't met in about 2 months, between like budget and everyone's like summer calendar was a little hard to get something on the books, but glad everyone was able to make it to this one. Obviously, a big shout out to the clerk's office and our law department for being here and supporting us. And if the clerk's office wants to take roll call.
Chairperson Miguel Sanchez,
President.
co-chair Corey Jones,
President.
co-chair Diana Garlington. Present. Kathira Manakaran. Present. Alan Williams is absent. Detective David Perez is absent. Michael Stevens.
Present.
Robert Bailey is absent. James Montero is absent. Lisa Pina Warren. Here. Juan Carter is absent. Michael Hogan.
Here.
And PJ Fox is absent. You have 7, 8 absent. You have 1. No, I'm sorry, 6 absent. I apologize.
No worries. Awesome. So we'll get started on our agenda item. As you guys are aware, Doug McCormick was an intern with the council office for quite some time while he was completing his master's. And he did a presentation around the work that we're talking about, a lot of community violence intervention stuff. So I'll kick it off to Doug, and he's gonna go over his presentation. We'll have a brief, we'll have a discussion on the presentation, and then we'll continue with the other agenda items. Can we get a motion to enter this presentation as an exhibit? Motion to enter this presentation. We'll get a second. Second, all in favor? Aye. Any nays? Abstains? Okay. Item number 1. Floor is yours, Doug.
All right, guys, thank you so much for having me today. I am Douglas McCormack. I am an MSW, recently graduated from Ryan College. And this is an analytical framework for evaluating community violence interventions in Providence, Rhode Island. I know that's a mouthful, but we're gonna title. You guys can skip over the table of contents page, which is going to be following the title page, and go right to the introduction. So before we go really deep into the data, I want to first talk a little bit about the context. Gun violence is a leading cause of premature death in the United States, disproportionately affecting marginalized communities. In Providence specifically, violence is concentrated in historically disinvested neighborhoods, and 79% of victims are under the age of 30, which perpetuates a cycle of trauma and disability. The main purpose of this research was to develop a framework for evaluating community-based interventions addressing gun violence, to assess how the funding mechanisms fluctuate, and identify any key indicators and limitations to measuring long-term. For the methodology of this research, we combined mixed methods to look at the crime data analysis, some of the funding, and we also did some community surveys. We used Excel for the quantitative side, which was the crime trends and the funding, and then thematic coding to do the qualitative side, which was the community perceptions and barriers.
Can you stop for a second?
Sure.
Okay, we just got the rough record reflect that David is going
So moving.
to. Sorry, Doug.
No problem. Ethical considerations, I just wanted to point out, ensuring everything was confidential, that we did the proper informed consent, and then gathering data in the survey, and then making sure we had diverse representation in that data as well. main, concern was prioritizing community's voice, using strength-based language and an accurate representation of the research findings. Some resources and challenges that I included were leveraging the city's resources, law enforcement data, and our community partnerships. Some challenges included inconsistent data tracking and limited time and funding, which sure everyone was familiar with that in a lot of cases. I just put at the bottom there, gun violence is not just a crime problem, it's a public health crisis requiring systemic. So, as I mentioned before, we're gonna look at three main key areas. We're gonna look at the crime data. That is, we separated it between violent crime and gun-related violent crime. I'll get more specific about that as we reach that point. The funding, which is gonna be looking at the city grant and community development block grant funding. That went to these various agencies, and then the stakeholder perspective piece, which was the surveys that I talked about. Okay, so you should have 1.1 violent crime in front of you. First thing we looked at was violent crime by district, and I think it's important to preface by saying the way Providence Police Department defines violent crime as offenses that include homicide, forcible sex offenses, robbery with or without a firearm, and aggravated assault with or without a firearm. Those are essentially the 6 categories of data that are tracked to identify what violent crime is in Providence. Some key observations when looking at that data were in District 2, we had Upper and Lower South Providence, Elmwood, consistently holding the largest share of violent crime in both of the years we reviewed, indicating ongoing challenges in public safety. District 4, while also historically a high crime area, showed a slight decrease in 2024, but remains among the most affected. District 1, downtown, experienced a substantial increase in the share of violent crime. And District 9 continues at the lowest share. So again, these are just some key, observations that we were able to pull from examining 2023 to 2024 crime data. Sure.
Yeah, would it be easier for us to save any question or comments at the end, or?
I do have a section for questions and comments at the end, but if you guys have something.
Yeah, if anyone needs any like clarifying questions, or anything like that, feel free to jump in, so. We're all on the same page, while we go through this presentation.
And of course, if I'm moving too quickly, like say that, I have a tendency to do so,
I think it goes fantastic so far.
Thank you. Excellent. On the following page, I have a visual representation of kind of those key observations that I shared with you a minute ago. You can see obviously, if you look towards the left side of that graph, you can see District 2 showing that, really level, high share of violent crime in that area. You can also see the uptick in the violent crime in District 1.
kind of overall, it's like District 7 is like. What, like, about 34%, but then in the other ones, there's none that get higher than 20% in one district.
Right, so, and I would say, we'll kind of get there, but, you know. Where I went with that was essentially, you can see that while you may have lower or reducing violent crime rates in some areas, sometimes that's accompanied by a increase in gun crime specifically. So even though the overall violent crime rate has gone down, you may see increase in, you know, or not necessarily severity, but the type of, you know, violent crime that's being. So I'm sorry, we're on 2. Here's a chart just representing that same data. And then if you go to the next page, just right around what you were talking about there, Corey, that's what I really wanted to highlight here. So the chart may be a bit to look at first glance, but essentially what I'm trying to highlight is these districts where you saw, you know, an increase of a certain or a decrease in a certain type of crime in a district, but then, you know, the opposite effects on the gun crime in that area. So I think a great, you know, example of this would be if you're looking at District 4, which I highlighted in yellow, it's highlighted for you guys too. We saw a 3.1% decrease in violent crime from 2023 to 2024. However, the rates of violent gun crime in that same district went up 4% in that same time period. So that's kind of illustrating those, you know, those gaps that I was talking about earlier. You can see a little bit in District 6 and 1 as well, where it's just kind of trending in opposite directions. That's really what I was aiming to highlight there. With that, you know, a drop in total violent crime doesn't always mean the community is safer. Gun violence tends to carry more lasting trauma and fear, and that, you know, as again we talked about, violence could just be shifting in form, not necessarily increasing or reducing. So the next page is just my recommendations with that analysis. Essentially, I would recommend expanding evidence-based CBI programs in districts 2, 4, 5, and 7. And the idea here is targeting, you know, areas that are experiencing the highest rates of these crimes. You know, with that intention of intervention. Also, some community investment, some, you know, economic and youth programs in these high crime areas to really tackle like the root causes of violent crime. And then of course, I may be biased, but I would definitely recommend continuing to audit these numbers and conduct this research every year, maybe expanding the length of time, just so that we're always aware of, you know, how these trends are changing. And I did put a little disclaimer on the bottom. I do believe a longer evaluation period than just 2023 to 2024 would be much better, right? The time constraint is really the reason why we're only looking at this one year to year. Again, this is a framework, it's not necessarily completely certain. On the next page, I also had a visual representation done by the great planning department here, the city of Providence. They really helped me, you know, get this together on the page. And essentially what you're looking at is in District 4 and 7, those are what I defined in my report as hotspots for violent gun crime in 2024 in Providence. So by hotspot, I mean an area that has 15% or greater of the total gun crime of Providence. Yellow being warning zones, which is similar, except it's 5% to 14.99. And then you'll see in the with no color over there, the districts 1, 8, and 9, which is saying, okay, less than 5%. All right, how are we feeling? That was section 1. Good, all right. So next, we're going to talk about funding analysis. That was another piece to this research that I thought was very important to include when looking at this today. You should have another chart in front of you. Okay, it's got 12 agencies on it. Take note of the 5 in bold at the top. Those are the agencies that are going to be represented in the following charts on the next slide, so just they know that. But I really thought it was important to include all these agencies here because it does include what I call CBI adjacent agencies. So while they may not be directly involved in community violence intervention work, they do a lot to address root causes of gun violence.
So you said which spot are bold?
I'm sorry, so on the top of that It says 2.1 CBI funding 2022-2025. The 5 agencies listed on the top left are bolded, so we have Nonviolence Institute, Family Service of Rhode Island, Open Doors, Amos House, and the Johnson Community Center. Those are the only agencies that are gonna be represented in the following graphs. The other ones are just included to give you guys kind of this overview of like all the different ways these agencies can touch CBI.
Thank you.
All right, so next slide, gonna be a lot of graphs coming up here for the next few. This is just looking at total CBI funding by year, so for the funding analysis, we looked at 2022 to 2025, we have 4 fiscal year worth of data here, so little, a lot more to look at, compared to the prime data. You'll notice that the highest amount of funding was in fiscal year 24, 23 to 24. Next slide, I just broke it down by type, so again, I only included city grant funding and community development block grant funding in this particular bit of research. You can see overwhelming that funding to those agencies came from city grant as opposed to the community development block grant. Next is those 5 agencies that I brought up to you, and this just kind of shows you which agencies received how much of that funding over the course of that year. So Amos House being the highest, and Open Doors being the lowest. I should repeat those numbers. Amos House was the highest at 1.1 million, Open Doors at 70K. Final graph we have here is looking at
There's a question, sir.
Hi.
yes,
So,
absolutely.
Section 2.2, I just wanted. For Jocelyn, it's the community center, right? Not the recreation center,
Good recreation.
No, it's supposed to be, it's
community center.
community center.
Okay, yeah, so
Can't be
it's
the
just a
rec
typo.
center.
That's
So
all.
there's.
Oh, thank you. Okay, perfect. I'll make note of that, but I appreciate that you correct me there. I think what happened was I used the terms interchangeably at that point, and so, but thank you for that. Next, I looked at the funding trends over time, so this, the main thing to see here is that the Nonviolence Institute had a drop off in funding from those 2 sources in fiscal year 25. We'll get into a little bit why I think that might be, but just again, kind of seeing over the course of these 4 years how that funding has fluctuated. So you can see Amos House saw the increase over time and then that fall off for nonviolence. The rest have been somewhat, very close to similar. Going to recommendation analysis of funding, I wanted to be clear again that, this is to support initial planning policy discussions around the future of funding these types of programs. This list is not exhaustive by any means. Obviously, we know there's more than 12 agencies and projects doing great work. And also that the funding itself was not exclusively earmarked for CBI, so these are just grants going to the agency. We don't know, we'd have to look, very closely at like specific budgets to see how that funding was being allocated. Again, we talked about 86% of the funding came from the city sources as opposed to block grants. Funding peaked in fiscal year 2024 and then declined significantly in 2025. Like I said, we talked about that. I'm making an educated guess that it had to do with the ARPA funds kind of running out at that time. Again, I can only speculate there. A small number of agencies such as Amos House and Family Service that I received the majority of the funds. And I think that maybe, reflected the broader priorities. Again, couldn't know for sure without talking. Nonviolence Institute received no funding in 2025. I thought that was important to note.
That's not accurate.
Oh, okay,
We did receive funding.
gotcha.
It
Okay.
might be that it was a late stop for the funding.
I wonder if,
So-
when I was looking at,
So I know, so that wouldn't have been reflected in city grants or CDBG, they got funded through our.
gotcha, so that's, so with that said, yeah, I will stress that, again, the only 2 sources of funding I looked at was the ones that come directly from the city there and the community development block grants. If it came from another source, no, I did not catch that, and that's why, again, framework, we would definitely add that funding if we were gonna expand this thing.
Yeah, just for clarity for the group, what happened is that. In past years, it had been a direct budget grant to the nonviolent institute, and this year it was a competitive RFP for nonviolence programming, so we had few bidders, including Nonviolence Institute and Nonviolence Institute that RFP. And so there is that sort of nonviolence intervention priority within the funding, it was just administered in a different way.
Okay, yeah, and again, you know, as an intern, I had access
Yeah.
to certain amounts of, you know, what was public, and I did my best here, but. Yeah, that makes sense.
Mostly just for the clarity.
No, thank you.
To add further context, I believe in the mayor's proposal that it went back to grant. Right, to,
But now,
well, the proposed budget, so
Okay,
that's what most likely is gonna happen next fiscal year, which. I thought July first,
hmm,
but we won't have a budget passed by July first, so. July.
So the next steps would be to conduct a deeper review of agency budgets to determine how much funding is explicitly directed towards CBI and CBI related strategies and where additional investments will be needed. So. Thank you, you're really leading into my next point as you ask these questions, this is great. But yeah, if we were gonna really look at this, we would need to look at all sources of funding. Again. And on the next slide, I have the same map that I showed you earlier, but I just tried to capture the physical location of where these agencies actually are within the city, so you can kind of see, you know, where they are geographically in relation to this, you know, percentage of gun crime. I thought that was an interesting piece to include. And again, this chart is for violent crime in 2024. All right, we will move on to our final section. That was the stakeholder survey. I have some data here representing who participated, so. I broke this survey out into 3 different sections, which were program effectiveness, accessibility and utilization of funding, and program impact and management. We had a total of 32 respondents, 9 of them were direct service staff members, we had 4 directors, 1 program coordinator, 1 participant, and 17 did not specify their role. But they did give, you know, pretty detailed feedback and questions they did answer. Next, we'll go with that first part, which is the effectiveness. So when compiling all the data and kind of making those, you know, thematic inferences here, we saw that respondents identified community support services as direct tangible outcomes. Those are things like the food banks, the rec centers, community events, etc. Victim services were frequently cited as highly effective in supporting families impacted by violence. Some stakeholders stated they were not in a position to evaluate the effectiveness, highlighting the need for a broader stakeholder engagement. Multiple respondents, I thought this was really important, I should start this here. Multiple respondents called for multilingual resources and transportation vouchers to improve access. Not saying those things don't exist, I'm just saying these were the results of our survey. Training programs received moderately positive ratings, which is good to see. Next, we'll go on to that funding accessibility utilization. So, similar to the point on the last side, you know, respondents expressed concern about the clarity of funding structures and how funds are allocated. I'm not exactly sure what that could mean, except that maybe, you know, more information could be provided to the boots on the ground folks as far as funding. Some noted that funding is being channeled to programs outside of the local community. A recurring theme was that firm funding does not adequately support client job training, therapy, and outreach infrastructure. An important note, client job training. So that's separate from the training with the staff that do this work. These are clients of the organizations that people are on like job training. Limited transparency and accountability with the lowest average ratings in the city. Finally, we'll move on to our 3rd section, which was the perceptions on impact of management. These programs were seen as highly effective when led by trusted local outreach teams. You know, people that know this stuff, people that do this work. Many flag a lack of real-time data and targeting leading to misalignment between needs and services. I believe that was something we talked about a lot in this committee when I was here as an intern, you know, finding a way to track this data live and, you know, be able to get a sense of where we're at any given time. Respondents also suggested a data informed referral system, which I also believe is talked about. I essentially put in parentheses like a triaging system for these types of things. And then a strong call for more collaboration between the city's agencies and the outreach workers. So with all that, I made some recommendations based on these findings as well. Programs focused on community outreach, including mentors and violence interrupters. That's, I think probably one of the biggest things we can do is fund those types of programs, incentivizing multilingual hiring, so allocating specific funding to give stipends to those that are multilingual in these areas. Development, and implementing that transparent data infrastructure, even just that live tracking that we talked about, and then ensuring that the funding is flexible, so that these programs can always be adopted, to meet the needs of that community at that given time. So, bottom line, where does this stand? CBI efforts and Providence are necessary, they do show real promise, but they are not improving. This evaluation offers a strong framework and raises key questions, but is not a conclusive outcome study, and I want that to be very clear. With more time, resource, and coordination, this work could support future evaluation and clearer findings. That's, really one of the big things I'm advocating for today is expansion of this. And then for now, again, it provides that starting point. I also included a quote down at the bottom here by Erica Ford. She goes by the Peace Doctor. She's a community violence advocate out of New York. I just want to share this quote with you. We want to shift how people think who run these systems, and we want to begin to look at violence from a public health perspective, so that we can then address these things from the ills that give rise to it, as opposed to the act of violence that somebody might be doing. And my takeaway from that was address those root causes, right? Address those, those disparities in the neighborhoods that have got us to this point after multiple generations. That's where I can see it. I've got a reference page, and now at the very end, comments and questions. I know that was a lot, so feel free to lay them on me. I'll do the best I can.
So. This survey, was it a survey that you had put in, or like a standardized survey, or how?
It was created by me with help some professors, and I do have a full report that goes with this, and everything is in there in the appendices and all that, so I'd be happy to share that.
So it's like, did you pull any questions from other surveys, or was it just?
No, I would say I was definitely inspired, but I didn't pull anything direct, I tried to tailor it specifically towards what we're looking at.
Yeah, I mean. Like when I've just been thinking a lot about the inverse effect and like. In like policy, they're training us to like constantly like challenge what your assumption is, and like what is other assumptions that can fit in that. And I'm thinking like maybe when a high crime event happened, maybe there's less reporting. Right, so maybe there's still that high level of crime that's happening, but there's less reporting, 50% of crime is unreported, right? And that's the hospital prevention methods to kind of track that to nurses. But yeah, I think there could be more than just, there's less crime, maybe that's actually, there's not actually less crime, and there's just less crime reported, and people get more quiet after a big event happens, right? Or maybe the crime moves, right? Maybe officers are patrolling that area more and crime migrates for that period of time, right? Which might make the numbers look a certain way. So I think that inverse effect is really important because it's showing us that something is happening in that kind of situation. And now, like, I think we can make a lot of assumptions and try to figure out what are the different assumptions, and if those assumptions are true, what can we do to mitigate them in a way that wouldn't bring us off track from what we're already doing, right? Assuming that assumption is true, right?
Can I add to that too, and maybe, Detective Perez might answer this question, sorry, put me on the spot. When it comes to aggravated assault, what does that entail? And is that's a felony charge, correct? Aggravated
Yes.
assault?
You're talking about your robberies.
So I'm going by here where he put the violent crime by district, and he said, these offenses include homicide, sex offenses, robbery with a with or without a firearm and aggravated assault with or without a firearm. I'm just stating kind of what Corey said, because I know sometimes depending on how injured the person was, you know, there's different specifics, if it gets categorized as a misdemeanor, if it gets categorized as a felony. So I was curious about aggravated assault.
So a felony will be dependent upon the injury and the use of a weapon or lack thereof. If there's no weapon involved in the assault and injuries don't rise to a certain level, then it's a misdemeanor. If there's a weapon involved, depending on the weapon, it's automatically a felony with or without the injury. And then if there's a certain level of injury, it's also a felony at that point, whether or not a weapon was involved.
Just to clarify on that, is it the police department that determines, with like the injury qualifies for a felony or how?
So the law, it's written in the law, but I guess ultimately on some level, yes, the officer who responds and who's taking the report is gonna determine to a certain extent what level of injury. So if I pull up and you have a black eye versus you know, your eyes bleeding and you got a gash on your head, like the officer is gonna be able to tell. Obviously, there's things that the officer doesn't know. So if that person goes to the hospital, comes back and says, hey, you know, turns out I have a broken orbital, you know, then that charge, if it wasn't already a misdemeanor, will get bumped up. But from first appearances, the officer will be the one writing that down and documenting that and charging as, I don't want to say as he observes it, but basically as he saw them.
No, that's okay, I appreciate the clarification, because I think sometimes that's also something to consider of how it gets categorized. I think that's important as well.
You find, Lisa, from your experience, that you have a lot of, or some situations where it kind of feels a little arbitrary in that kind of classification?
I mean, mostly around aggravated assaults, right, because it's really based upon whoever's lens is seeing, you know, so it really depends. I mean, there's been times that we have advocated for, you know, a higher charge, or, you know, supposed to be categorized differently. But, I was just curious if the thought was that it would impact these numbers, which obviously it would if it's not categorized as a felony or aggravated assault.
Yeah, so it's worth noting that the data that was pulled for this research was wholly entirely just the data that's published by the
Yeah.
community, so. However, it's categorized on your end is what would be reflected here. If there is some subjectivity to it, you know, that would not be captured in this particular
Right.
research.
And, you know, just to make note, you know, we respond to all victims of violence. So if they make it to the hospital, we get a call. So it could be something that falls under a misdemeanor, but this person was victimized, he or she was assaulted, could have potentially been robbed, and you know, I don't wanna be that person when it comes to the city and to, you know, police to say like, I see myself or my team sees things that's not always reported in the same manner. Obviously, if there's a shooting and a homicide, we're going to care about it, but we see a lot, so my lens is a little different.
I think it's important to understand the limitations of committing, because these are charges, right? They're initial charges, sometimes they get over.
Right.
And this is if you've got someone to charge. So these incidents sometimes is not necessarily the incident, and then an incident could lead to multiple charges for multiple individuals, which is what could show the shift in an individual. But we're in the district, right? So if a single incident happened in the district that had more victims or more charges, that's what's gonna show that shift in data. Not necessarily on the incident that occurs, and I've been living with this, trying to understand all this data as well, you know, property crime and the charging. We talk about there's no nice stuff here, there's a lot of nice stuff, right? There's a lot of nice stuff, and that's not, not even, but those are the charges, he's right, those are the categories of how they say that this is violent crime, and those are the charges, and the way that the analysis works, so it's not perfect, right, but it's reflective, and then when you stretch that out and you go back, it definitely will show you trends and everything else. So it's that small sample size, but also understanding that if an incident happened in December and someone's arrested in January or February, it's gonna show up in the next year too. So there's some things that are happening that go into some of that. Iris is not perfect, but there's a lot of interesting things. So if you want to do a deeper dive, if officers are thoroughly filling out their incident report, there's relationship data. So you say, well, these homicides, and if there's a charge or an aggravated assault, what's the relationship? Is the family member? Is it a stranger? Is it a
Yes.
crime? And things like that. So there are some more valuable pieces that can be pulled out of, not necessarily what gets published as the aggregate, but what's available. And to help understand what the numbers, because I mean, we're not looking at the numbers, but the numbers there, it's 14 homicides, and how many of those were family members or with some intimate partner?
Yeah, and I know that like, in Atlanta, their health department, runs kind of a violence reduction office that does that exact thing. They look at, what is the relationship with people who are committing violent crime. They do a social network analysis, and then they're able to kind of predict, young people who are, more likely to be involved in violent crime, and then targeted early, with like supportive programs, like home visit and parent training programs, prenatal care programs, things like that. And they do it in that strategy to make it so it doesn't cause over policing, but then they also are able to identify some of these underlying, issues that exist. We're not a big city like, Atlanta, so it's a little different. We have to rely on like the State Department to do something like that.
Doug, while you were doing all this work, did you talk to anyone, or did you see anyone else like out in the community or any other state or city agency, analyzing this type of work?
Truthfully, I did not have the capacity at that time to really do that much outreach. Like, there was some outreach over email, but as you know, like, everyone's very busy and it's hard to get at. So again, with the time limitations, like, I didn't get to talk to as many folks that I would want to, that are also doing the work in this space.
I guess that question would be opened up to everyone else in the room.
Okay, it's a function of my office to do that, which is why I know about the limitations and the reality of it, but it's what you have access to and data. In Rhode Island, pretty much every department uses their own records management system. That's shifting right now. There's a new statewide system coming out, but then you have to go through the permissions with the individual departments, and it's also, it can be, and we're working on it. So we're trying to provide better dashboards at the state level that look at all of this, and all of that for all the cities and towns comes to our office on its way up to the FBI. So, but really, like I said, understanding it and getting into the reality of it, but really like on the road with Atlanta, when they bring all the resources together, they're probably bringing public health too.
Yeah.
We're getting the emergency room and urgent care visits, and sometimes those things that aren't getting reported to law enforcement, but people are still seeking care for injuries and stuff like that.
Yeah, and then they track it down to the location, because they can't tell them the, certain other information, but they'll tell them the location, and then they'll kind of build like hotspot mapping to figure out where the unreported crime is.
So we're trying, but it's funding, it's technical know-how, it's the technical information exchange and overcoming everybody is kind of part of that, certainly part of it, but it's all public. That aggregate information is all public and comes through. But like I said, the real information is digging deeper, the relationships, when these things are happening and other stuff that sometimes are in the narratives that an officer writes up after an incident that may not even ever make it to an arrest, but there's some gold in those record management systems. For better understanding violence, so we're working.
So to be like specific to Providence, is there anything like the city can do to help support your work on this?
It's a good question, and I think well, it's complicated, so let me think about it. I think it's, I think there are some analysts in the city working on these things at the department or, that help put those reports together and stuff like that. It's finding those resources and getting everyone to agree and have more meetings like this and things like that. But I'm trying to build that. Because again, from the statewide perspective, people have this, what are people's perceptions of the city of Providence? And because they saw someone on a four-wheeler vehicle once, they never want to come to the city. So I think helping the public better understand that, putting numbers to those things, like it's, there's violence and we can get to zero, but I think the public perception is significantly worse. I think by being more transparent, I think Providence Police Service does a great job of publishing that data. Everybody gets into that, Dan McGowan's cut his teeth on publishing reports on that data, so. It's so, there are good things happening, but yeah, how do we better cooperate at the state and local level and stuff like that is the challenge. So I think it may go into the third item here is how do we get the legislators to back up stuff like this, so. There was a justice reinvestment effort, where they want to have a better understanding of the population of the state of Rhode Island, that's on the folks that are on probation, how many people are on probation, what's the risk and things like that, and it's that sort of thing where if the legislature wants a report and wants to do that, then resources can follow. So it is I think it kind of leads into, let's, talk to the delegation when they go back, and I think they're aware of our office would be victim services and we've been knocking on the door, but more understanding of the actual violence. I think a lot of it is intimate partner violence, a lot of it, and it's not understood, and we're not talking about self-inflicted gunshot wounds and other things like that. It's not about suicide, homicide is different. So we really want to understand the violence and how people are dying by guns. It's a bigger look.
Thanks so much for providing, the insight. Does anyone have any other questions or comments for Doug? Regarding this, report?
Just wanna say good job.
Yeah, great job.
Thank you
so much, man. It's a lot of work.
Yeah.
Appreciate it. Good job. This is about 8 months in the making.
Right.
Do we have something?
Yeah, we'll probably say questions from the public towards the end. You can write it down well.
I have more time, but we save it for the second half.
Yeah, it kind of goes into the conversation, so we can, move straight into item number 2. Discussion on community engagement, educational strategies that prevent gun violence. Who wants to start this?
So this is kind of like going off of Doug's presentation, but it's kind of like where I think we could build off of this. This map was kind of like something like what I was trying to build, but to finish it and add the rest of the agencies. And to like try to like categorize what exactly do they do that's like CBI adjacent. And then kind of complete that crime violence analysis to go a little bit further. And then try to as well finish the funding analysis, go a little bit further. And I think if we have all those items, we would have enough. We would have enough kind of evidence to build an argument for how much we need and for what. And I think that's the biggest kind of, task is like, how much do we need? What is our justification for it? And then like, next, kind of like the strategy to get there, which is ever evolving thing, right? We might say the assembly and then, our dodo pass and we go to the council, and, so. But I think to finish this list, to kind of identify the, what each org is doing, and then also kind of like analyze where's the capacity, so we can kind of use that to justify our funding analysis, right? Like the nonviolence institute needs 15 triage nurses, this organization needs this many beds, this organization needs this many therapists, right? And then, what is our strategy to get there?
Some time ago, trying to feel about all the recent started, speak about this community engagement. So it's basically directed to Lisa though. As far as the environmental convention, in your, community outreach, has that been reestablished at Institute or?
Always have it.
Well,
We still have the outreach workers.
oh, we do.
Yeah.
I thought that was.
No, we have a much smaller team, so we only have 2 full-time. In Providence, and the others are in Woonsocket, 1 in Woonsocket, a part-time in Central Falls, and a part-time.
Okay.
It's only 2 full-time in Providence right now.
You have one full-time at Woonsocket?
Yes,
And the needs 15?
I mean, that's a great number, I don't know if you got that number, but. No, if we need would be an
Oh, yeah, I heard.
But yeah, so. Obviously, having a smaller team, you definitely have, less capacity. But the work is still being done as far as. Trying to make connections with those that, gather information that we know are the ones that are at highest risk to, become a victim or make someone a victim, so we try to really make sure that we're connecting with those, lots of times we get referrals. I think sometimes what happens though is not everyone understands what an outreach worker is. Many times we get called for like more like a security type role or a policing role.
Yeah.
And then other times we get calls for like, a big brother mentor. And there's a little bit of that, but it's not, we can't take on every young person in the entire city, right? Or the
These like
entire state.
families calling.
Yeah, or guidance counselors, even churches might call us and say, hey, I have a young man that is a mentor, in an outreach worker come. So our goal is really to make sure that we are connecting with those that are what we say is the highest risk. To cause the violence or become a victim of violence. And obviously that, the only way to do that is just the continuation of gathering information. Some of it is with our, friends at PPD or other department, across the state will actually share information with us and say, this young person is a high risk person, you might want to connect with that person before it gets to another level. And again, social media is also somewhere where we figure out a lot of the, who is really in those most powerful positions that we can connect with.
Is there a number for how many street outreach workers would allow you guys to adequately staff the city?
That is really hard to say. I've been there, obviously, when there is 2, and I've been there when there has been about 20.
Yeah.
Right, it really depends. If I had I would myself would really be happy with, I would say maybe 10 full-time outreach workers that, were connected to different parts of the city. And that was just the focus, because obviously that I have us spread so thinly.
Yeah.
It's really difficult to cover all areas. And we are actually in the process of, hiring potentially 2 more right now as far as the funding we have.
So Lisa, 10 sounds good, but I think you need more.
Yeah.
Here's why I say you need more, not, 10 full-time now, but when the summer hits, you need some part-time. Because this is where we're heading now, we're hitting the summer, we got midnight basketball gonna be starting. We got all these rec programs that's gonna be starting outside, water parks, schools, we're gonna need as much help that we can, because if we look. But honestly, we're in a good situation with crime being down, gun violence being down. I'm not gonna know what it is. They have taken 146 guns off the street. 146 up to date to yesterday, 146 guns off the street. We see that our other cities are starting to get on fire. We don't want us to start getting on fire. So my opinion is the work that you're doing is new. People notice it, right? My thing is, can we do more? We always can do more.
Absolutely.
But we have to get prepared to know that right now. It's our vulnerable time that we're gonna need everybody put on board to making sure that we keep these streets safe this summer. Because there's a lot of stuff going on. So that's just what I wanna make sure we understand, like, we're doing okay, we're not doing, we're not
I-
from years ago to what we are right now. I wish I could get you percent, I was trying to get it for you, but with our crime is down.
I agree, Mike, I'm just saying in the sense of, you know, onboarding 20 people, right? And getting them trained up, because that's also a big mistake that can happen in an organization like us. You hire the wrong people and you put them out on the streets, the issues can get worse. So we have to be very, very careful and strategic on who we bring in and how we onboard them and how we, you know, put them into places that we put them in.
Well, on this, too, Max, I know how to work that you're doing, so it's like you can.
I appreciate it. So I would love 21 day, but I wanna make sure that we do it the right way, and make sure that the right people are.
And that's, I've literally read a study that said, like, city's getting too much money, hiring a bunch of street outreach workers, and then, you know, people are running criminal syndicates while they're street outreach workers, and kind of move with a little bit of immunity.
And we had it happen, we actually had a person that I still strongly feel like was really in the role to be able to have access into our database and give basically the drops on people and say where people are living and so on and so forth. So that was very, very scary for me, and, you know, we've even changed the way we enter data and who has access to certain information. But, so it's really strategic on how things happen, and it can be time consuming, but I think in my role now in this, with the hat I'm wearing, it's very, very, very important to make sure it's the right people doing the work. Because if we're not respected, we're not going to have an impact.
Thank you for sharing that as well. Is there any other comments on this topic?
I'd just be curious, especially the practitioners in the room, with the recommendations, from the analysis. Is there, you know, which of these should we consider? Do you agree with them? Do you disagree with them? How can we use this information, this analysis to, you know, inform like the next step and 3.5? A few pages from the end, but like. In the last year, I know that everyone here is doing all of these things and that various is not cool, but. Like, are there ways that we can sort of implement these in the next step? For community engagement and education.
Not necessarily a question, just more a comment. I think the highlight of multi-level hiring was interesting, that I definitely see and support that, but that's not something I really have heard in this space. So obviously there's a big push at the state level and just getting more funding and resources for multilingual education in general. But specifically to this type of work, I thought was interesting, and I can see, especially in a city as diverse as Providence, it being a need. So yeah, I mean, I'm kind of curious to follow up into that civic recommendation a little bit more and see what type of work can do around it, if any. But yeah, that's just my quick comment on that one.
Yeah,
I can speak for, you know, obviously also strategically in hiring. Try to ensure that we hire people specifically for the areas that they're going to be doing the work. So if it's a highly populated Hispanic area or Asian area, especially when we talk about gang, like once upon a time in Providence, we had a heavy Asian gang population. So we had multiple Asian, you know, Laos, Cambodian, so that those were the trusted individuals that are able to do work. So we do really try to make sure that we hire those that fit best in the community. And to communicate to the community.
yeah, I think the transparent data infrastructure is kind of one of the most obtainable things for like the group at this table. You know, I think, you know, increasing funding or changing funding is aspirational and a good long-term goal for us. But I think, you know, with all the technology we have nowadays, the biggest hurdle with the data infrastructure is going to be the kind of dealing with people's personal information and trying to figure out the right place to harbor it. But, you know, you could create a database with a, you know, AI, a large language model, and make it so you can parse through kind of the data we already have in a more accessible way with little to no money, right? As long as it's a safe place to hold it, and this MOU and all those things are in place. I think that's one of the attainable ones. Or more quickly attainable.
It's really exciting when people volunteer for projects, and it sounds like we're the volunteers.
Oh, yeah.
I have to go, guys, I apologize.
Elisa,
You too, thank you. Thank you.
The only thing I would like to see with these recommendations is for us to be a little bit more inclusive in regards to a lot of the programs that are in the communities that are already doing a lot of work, whether it's the football, soccer programs, boxing programs, wrestling programs. These are people who know the kids, who know which kids are teetering, who know which kids are struggling the most. When I coached football, I knew which kids were going home and what their households were like and which kids we had to keep an eye on and try to keep them around other kids. And so I think that when it comes to including mentors and violence interrupters, we have a huge ally that we're not even tapping into, at least not from this conversation, with those programs that are already, they're not doing it for that same purpose, but they're doing it. And they have a great amount of knowledge when it comes to the kids that they're dealing with.
No, thank you, for bringing that point up. We've been trying to get our rec director and parks, teams in here just for them to give their spiel on what, programs are provided on the city's end. Obviously, there's a lot of community programs like, once down, one that comes to my right away that do a lot of work that is in this field. The timing didn't work for those guys, right? So that is something that we're still trying to get in. Okay?
Yeah, we're looking at the data, and the data is showing District 7, and we have several things right in District 7. Jason Estrada has his boxing gym right in District 7. I'm sure he'd be a huge asset to combating some of what's going on.
So I think we already have city. Like, rec centers, that's the city, well, we should be, work with them on that, like, that's easy. That's maybe going off to find anyone else, they're already in our rec centers. Those rec directors know those kids, those assistant directors know those kids, we gotta work with them to help us. I think that's important, so if we do bring in a recreation department, I think they do a lot of great programs, so let's put it out there, they got a lot of great programs. And they got a lot of those kids that we will see sometime at Henry Plaza or someone to the act on our school, they are in those rec centers. And you know, something that's part of their home, they feel they feel safe there. So my opinion, we need to tap into the rec department and get those kids who are more at risk that need to be able to help. I think that's important.
That's what I wanted to bring up. Is, I'm in District 7, so, as far as, working with the recreation centers, I was wondering if maybe we could, find a way to maybe implement like community ambassadors or something like that to work with these recreation centers, because I see it firsthand.
Sure. Yeah, you know, you guys kind of just brought me to like, I think the real next steps is to go further into this analysis, right? We have to know those people like they know the kids, right? And once we know those people like they know the kids, then there's no more silence, right? But the fact that, you know, I don't know those people that know all these kids, how are we gonna be able to get to the people we're trying to get to until we properly have mapped out, you know, who's the asset? And then what is your qualitative analysis? Oh, it might not show on paper that he's doing this work, but he knows all these kids, he talks to them, I give him a call, he'll give this kid a call. That's not there's not a program for that. But he's doing that work, right? And then we need the qualitative, what are they saying in their reports, right? Like what is Tides doing, what is, these different agencies doing? And then I think from there, the gaps will be in our face, right? Like there's nobody we know that's covering this area or covering this hotspot. And maybe y'all know some activity that's happening there. right, and there's no direct linkage, right?
You should have a, you should also have a social leadership. Whatever, that's it. We should have, maybe we should know, yeah, so that you can ask the board for us to use, like, we gotta, whenever, you know, go back to bond, and I know we can come in and really talk about. That's some great programs, they do a great job, that's a great job. And I think that we bring them in, we can be able to tell them something that we're looking to do, I know that we could probably get it started, as that can be our starting point. For working with the rec centers, and then explain now.
And I just quickly add on that, Michael, yeah, I mean, I've seen it firsthand, my experience as a member of the rec advisory board, which we've been meeting every month at a different rec center, big shout out to our clerk's office who goes with us, today we actually have our meeting at Super at 6 p.m. if anyone wants to go there. So it's cool to see all the, not just directors, but the staff members. And I mean, I would say if not 100, very close to percentage wise of the staff there are kids that grew up in that rec center. So they have all the historical context and community relationships to really be in positions to help our kids. But I've also been participating in my colleague, Councilman Peterson's initiative of, we've been also going, a bunch of state and city electeds have been going to different rec centers and playing the kids in basketball games, the last Friday of every month.
Once you work on that jump shot.
I will say, a little embarrassingly, we won one game. And that was after the Zucco kids beat us the first game, but we ran it back and we did beat them for the record. But it's cool seeing all the different kids and all the different rec centers. They really are gems in our city. So anytime I can uplift and support the work that our recs do, all of us should definitely be doing that.
And you know, Jack is really the director of Zulu, he's absolutely phenomenal. Like, that's one, it's a great director, he really cares about his community, he cares about those kids. You know, I can't talk enough about the work that they do, so. I think we should do it.
I'm sorry.
I'm sorry.
No, I want to throw, Beat the Streets, the wrestling program out there too, the young people I've worked with, I know a few in Concord there, Washington Park, Little League, all those, but I do want to mention Providence Housing Authority too, so you want to meet kids where they're at, they're gonna also have a good idea what's going on in families and in the households. We've been building for a few years, like some victim services and community services with them, and sometimes the folks in the community are more likely to call and file a complaint with the victim services person than call the police on their neighbor, you know, they got a complaint about whatever. So we're really kind of building a little bit of community outreach there. And would probably be a good resource to help them to identify. I think this gets to resource like targeting, but we're targeting the kids that need the resources. So instead of CBI for the resource targeting, we also, how do we find the referrals is something we can talk about for you. These are the folks that can help us find the referrals and maybe also give them refer out. So.
Yeah. Yeah, I think even making a referral system, I think could be one of the attainable things, right, that we can make happen, but there's so many questions about, you know, just logistics.
What do
Yeah.
they want to do, right? What can we refer them to, can be all these things. It's gotta be something they want to do.
Yeah, so for that, we would almost need to build like a bubble map or like a kind of like an architecture type map. Because you can use like Power, what is it's like, you can use Microsoft 365 tools and kind of automates referrals to certain individuals, so people fill out an application. And it's cheap, but it's not simple, you know, just get 100+ referrals. And then there's also stuff like Unite Us, which is really expensive. I think they quoted us for like 20 counselors at like 30,000. But Unite Us has like, I think 780 programs at the state level already implemented inside of it. Veterans, Department of Health, all their programs. Yeah.
Anyone else have anything else on item number 2 or next steps or anything they wanna? So I forgot to mention, so Isabella from our policy staff is gonna be like our main staffer, so. Do you think you got an email from her at some point? So you should have her contact info if you need anything researched or you want something shared with the council or anyone else, should be our point of contact. Our leader. Smells good. But yeah, we can move to item number 3 if no one else has anything. I think this is Corey, and then we'll have some time for public comment.
Oh, yeah, so, at our next meeting, I wanna invite, Representative, Jennifer Boylan and Representative, Teresa Tansey, to have a discussion with us. They are interested in maybe carrying a bill for us, regarding, you know, what we talked about was, a tax on ammunition and guns that would go into a dedicated CBI fund. And, you know, there's a lot of different kind of levels to how ambitious that bill could be. It could be just simple, it could just be taxed, it could go into a grant, or it could go into a direct line item, or it could be a complete restructuring of, you know, Mike's office or another office, to be kind of committed to that work, right? So, they want to analyze kind of our commitment because they're like, we're willing to take on whatever level this is, but we're gonna need like strong advocacy behind it. We're gonna need the CEOs to be ready to advocate behind it and people ready to testify in the next legislative session. And so I, you know, figure let's start early and, you know, see what is kind of our appetite and then, you know, what type of coalition we can put together.
Who could bill, take the tax money and give it to the state, administer to municipalities, or how would I get that?
That's a good question. So that's for us to kind of debate. But you know, one way we can do it is it goes to Mike's office where he's already, you know, funneling in tons of that federal dollars. And the idea is that if it went to Mike's office, he could use, use some of the money to kind of be more strategic about some of the federal dollars that they give over the years. It could be a direct line item to organizations, right? Like you could say, give it, Nonviolence Institute was supposed to get a line item, you know, let's put it in directly to them. It could be directly to the city, or it could even be, you know, another kind of offshoot office that is kind of administers grants. Like our office administers all type of grants, not any specific one like this. But you know, sometimes people go send it to GWB because they have a clause in the RFP process and they're able to kind of circumvent some of the steps, you RFP one time, and then you're able to get money at a moment's notice if you've already RFP in our system once, right? So we can get creative and see like where's the fastest to get it on the streets, where would it maybe have the most impact with other funding, or you know, where's do we have the most control, right? I think it's kind of the values to trade off.
Always that funding mechanism, and I think that this would probably not have been the session to try to add a tax to.
Yeah, but the way the salt was
I don't know that that's ever gonna be, but.
Yeah.
But another funding source has risen in all of the news in the last few months, and it's like sort of that attorney general settlement funds.
Yeah.
And this is something that the federal government did this a while back, about 2 or 3 years ago, they did the same thing with the federal attorney general's office. And those settlements that attorney generals can negotiate before the judge, you know, issues or any kind of other penalty. Those weren't necessarily being directed or being directed to the general fund, but it seems like that's maybe an opportunity to say percentages of that funding should be going to, I mean, we're also trying to fund the Victim Act, right? So all the victim service providers that have been affected by the cuts, domestic violence, sexual assault, and the federal cuts have already happened, but again, there's some funding, and the Attorney General also endorses that, and also endorses and has CBI, PJ Fox, so it's weird that we're not making that connection.
Is that opioid funding?
No, it was the 610 connect, the contaminated soil on the 610 connector, it was a large dollar settlement, and that's being directed to the Rhode Island Foundation. But really victims of crime and some other, you know, I think that's kind of what I said, well, you know, we're looking for criminal justice related funding, seem to be getting some, so that's kind of, you know, I think something for us all to be talking about. It'd be great to have some legislators here to talk about.
Right?
Yeah. Because that isn't a tax, you know what I mean? That's penalties that criminals pay, so we should be going to.
I definitely think that's a better approach.
Yeah.
I'm not a fan of more taxes.
Had a lot of guns.
I don't anything.
Any other comments on that topic? I think it's an interesting one that we should definitely explore. Yeah, I mean, I've said it at the beginning of the committee when we first started. It's a very slippery slope, I think, sometimes when we start advocating or talking about different bills at the state house, but it obviously impacts us. I just don't want us to become straight up like advocacy group for like state house legislation, because that itself is a lot of time consuming and capacity, and what I really want to do is try to expand it and see where CBI strategies are most needed here in Providence. Obviously, if we get to a point where we need certain money or certain state legislation change specifically for that, then we can dive into that world. And I think Corey's idea of this bill, because that would be specific funding streams to this type of work, I think it's something we should definitely explore forward.
Yeah, Gina tried it in 2019. And she put it in her budget, and they took it out, but that was under Mattiello.
Yeah.
So it's a little different, and then, the thing is, the tax is supposed to also incentivize people to not buy more guns. Right, so it's like a sugar tax, right, you buy less sugar, you buy more healthy foods, right? And then if you do wanna buy sugar, you do wanna buy a gun, it's gonna go towards stopping violence that is possible to happen from that.
Mike, you got something else?
Yeah, well, I just in thinking about future meetings and good to keep us on track and with what you're saying is I wouldn't mind doing a little bit of a deeper dive into the incidents that are happening that are causing in those neighborhoods. What is it in those neighborhoods that I put them on the map here and make that and start to do a little bit more, because I don't see what gets published with WPRI or anything else, so I don't see what's in the news and I see numbers go by, but I do think it'd be good, we looked at Kennedy Plaza knowing that that's a hotspot, but really now we have some hotspots. And it's time to, some of these are generational beefs, some of these are incidental things, some of these are, but what's driving the violence? And why are those neighborhoods now red?
I think what we probably might want to do, and I'll talk to the colonel when I get back, is they've got we got Dan, who's our specialist, does all crime statistics. Maybe he can come explain how he does his crime statistics, how he manages it, maybe I can explain it to you, you will know better than. I can't explain it to you.
No, I think that's a great idea.
But I think if he comes, he can tell you how he got his, how he does it, so I think that'd be great.
We can also, if we request it ahead of time, we can get into a lot of, you brought up the relationships. That's recorded on all of our assaults. The victim suspect relationship, whether they knew each other, whether they didn't know each other, we do keep that, that's all on record. But it's not on the public release, at least I don't believe it is. Those are things that if we talk to Dan ahead of time, we can get that, and it will help clarify or at least understand some of these statistics a little bit better.
Yeah, I don't know how good your relationship is, Mike, I obviously don't have to get into it right now, but that's something I realized is like a big barrier at times, is like people are just so protective of like their data, so even like hopefully, we have these conversations here, but the relationships, grow stronger between your office and our police department, and hopefully, we get to the point where you guys are very comfortable and you have the permission by all the superiors to communicate freely and share that data on the intention of it benefiting the work that not only us, but your office and our police department is doing.
Just on the police department, every data that we have is online. Like there's no hidden, there's nothing hidden. They put everything online. So if you ever want to see it every week, it's changing. They give us they put up every week all the statistics for the week. So you'll see it. And you can see that the trend will goes up, will go down, will district. You'll see all that online.
But I don't think, from my understanding, that someone can just like pull a report from all that data.
No.
Like, I know.
Specific report.
Yeah,
No, no.
so that's what I'm saying, like, for example, like, I'll air it out here, because me and the chief are really good. Like, there was a time, a couple, probably a year or two ago, that some of us counselors were trying to do, legislation around, traffic enforcement. There's a lot of cities that are doing ordinances that, will say these 6 things, Providence police or anyone doing traffic enforcement shouldn't pull someone over, one of them was having. Something like the rear mirror and stuff, so we were, a bunch of us were trying to get data and information, and it really took. A lot of political pull with the administration and the police chief to try to get those reports, where it's just, it all came to, the reality was that, like, our department was doing pretty well already, so it didn't really necessarily require us to do, some legislation around this, but that's why we wanted to get to it, to see, like, this is something we wanna do to, make traffic enforcement a little more equitable and, productive. For not only the police department, but also our constituents. But it did take a lot of, conversations, and, it ended up being in a good place for everyone. But that's where I kind of learned, I was like, oh crap, even though we're all the same team as the city of Providence, we're all have our different, priorities and goals and perspectives from when coming to these conversations. Which is fine, which is fine.
I'll tell you, it's not just Providence too,
Yeah.
like, in the state level, I was in the governor's office and getting told by the governor to get this for me, and people were asking me 1,000 questions, and I'm like. I don't know, and my boss had to tell me, I'm gonna call her and explain to you, but when that happens, you say the governor's asking for this, so I do that. Right, but it's like, I was trying to get DCAM data on all of the state properties. They were like, no, we don't, that's a can down that we kick down the road, we don't want anyone looking at that, because there's a ton of properties that have all these things like asbestos. City owns the land, the state owns the building, we don't want you to get into that, because you wanna use it for housing, right, and DCAM was giving me hell, and I'm like. And then it's a monthly.
I can just tell you, as far as our data goes, if there's something that you want that you're having a difficult time getting, there's a solid chance that it's something that's not parsed. Because as Mike said, a lot of our information is already thrown out there. If it's not parsed, then somebody has to literally go into report by report to find that data that you're talking about, and we're short as it is. So finding somebody to do that, that's a very large task, to have somebody go into every report to find a specific bit of information so that you can draw a stat from it. If it's not already parsed.
We're volunteer already.
Or you have no capacity, since the bosses had to pick a site.
Yeah, let's, if anyone from the public has anything they wanna share about, I had a question for Doug earlier, thank you so much for coming. Yeah. Question about?
There's really impressive, great.
Well, thank you so much.
Thank you, guys.
And I have a comment about data collection. Then, I have to find your counselor said that data collection and some of my other advocacy work besides the loans prevention has been really slow. And AG's office helped us get right on data about traffic safety. If we couldn't get it any other way, the police department had given us the promise data. Get every single data, because it's really something exposed. I'm worried I feel protected today, but it was really transformational. To look at data, to look at the soft data where we get interviews with stakeholders. And I'm curious how we protect our rights to continue to collect data. The police department has a right to collect data. When 8 years ago, the ATM was being dismantled in this country. And a lot of data was not allowed to be collected nationally. It scared me. I lived in Ohio before living there. And there was a lot of departments and a lot of agencies around my state where data was not allowed to be collected. That's how people politically manipulated situations. So I would like for my city province to be ensured to be able to collect them, I know that's really part of the situation. I would like to know how we can legally send maybe some kind of statement that we should be really sure to do that. So that at least at some point, even states' rights will come forward for CEOs, that we're allowed to do our thing, regardless of what's going on nationally. Because I'm very scared about that. I'm scared that national circumstances are gonna make it possible for us to look at the data that we look at. I don't want it.
Cool, go ahead. I'm Ray Gordon, I'm from the Frank's office at the Department of Public Safety, Lexington laws. So, but I'm not sure my thoughts represent the Department of Public Safety. So, you know, I come to a few of these meetings, and it's a lot about intervention. And intervention is obviously needed, it's very important, and it's very important. But sometimes I see this, like, the terminology gets a little crossed here, is when you talk about, like, for example, you have, you know, pathway to end gun violence. I don't think you're gonna end gun violence with interventions. Because what's happening is you're in the river, you've heard this expression, you keep pulling people out of the river, you keep pulling people out of the river. I think what you need to do is go upriver and find out what people are falling in, and that's prevention. After an incident has occurred, anything after that incident is, intervention. So it's hard to get the data on prevention because, you know, let's say, for example, I want to reflect on what both of you were saying. In that you need, positive, I'm trying to think of protective strategies that, work in a child's life, in a family's life, before they even enter a system, enter a program, enter therapy, enter school. School, right, is just, how do you control 30 kids in a classroom? There's no difference between play, this might be shocking for people, but there's no difference between play and learning. They're the same thing. You know, when my mother would tell me, go out and play, will you? I think she really is saying, go out and learn. Because that's what it's about, right? It's all about brain development. Children's brains developing all the way by around 21, 25, whatever that is. But, you know, 3 to 5-year-old to pre-10-year-olds, those brains are dying to learn. And how they learn by interacting with the world. And when the world says, here's the boundary, and here's not the boundary. So the idea for us is to create healthy, positive boundaries for them. So I don't know all of you. I know Lisa across, that's intervention, and I suspect that most of you are from intervention type of places. So I guess I'm suggesting, is what is your focus? Is your focus intervention? And that's perfect, that's great, because you need intervention services. But perhaps, as I noticed the item on the agenda is strategies that prevent gun violence. Is to look at prevention, perhaps it's a whole other committee or subcommittee. From you were talking about soccer, leagues, baseball leagues, those are vitally important. I mean, that is what kids them to interact and socialize and with a good coach, who may be trained in prevention strategies, because that's a whole underlying piece of it. Is to get things together like the children's museum. That is the ultimate. I worked in intervention at home. And I kept saying, you know, I was with adolescents. I said, I told the adolescents, that's not prevention program, it's not prevention program. It's not prevention, that was intervention. And I thought that the Providence Children's Museum is the ultimate in a prevention program. Because again, they don't distinguish between play and learning. And so the children go in there and their brain that's growing, that they have more opportunities and more things to do and more, more family involvement in this. That's really where the neurons in your brain, right? Neuroplasticity, neurogenesis, all of that is happening. Those wires are connecting. And the more they connect in a positive aspect, the more they will be prepared to resist gun violence, drug use, sexual abuse, all of that kind of stuff.
So I guess, the motto of Children's Museum is a children's museum is a place where, children play to learn and adults learn to play. So I guess I encourage you to, add some more of that thinking. I can imagine, a children's museum that could outreach all of those, red places on the map and have, museums without walls that take the place in a neighborhood block by Boston. I just saw the mayor announce this thing, like $750 if a neighborhood would put together like a block party or something like
Yeah, they
that.
also have like the drive-through museums.
Yeah,
It's like you turn the city blocks into kind of a museum and just drive through it.
so the process is long, right? We're up to 21. So that's where it is, but the closer you start to grow up and getting them on the right track, involving their families in this, I think the better off you'll be. And, the underlying piece of this, which is kind of out of the blue, is racism, right? That really is what is holding, back a lot of, good stuff that can be done. So perhaps the subcommittee with people, some interventionist people, but, the soccer team, the children's museum, someone mentioned another program around here, they did some outreach, like interventionist type of work, interrupters. So that kind of thing, that's what I thought, just to kind of maybe hear the language and know when you're talking about intervention versus prevention. And that prevention, an ounce of prevention, is worth home to.
Thank you. Thank you.
And as far as the names of the two legislators who are both
Jennifer Boylan and Teresa Tanzi.
and may I ask this information in your wonderful research, Mr. Norman, can we share it with anybody, say, an article for the Providence Eye or a city councilor? And just be terrible knowledge,
Yeah, I mean, at this time, like I've published the report on academia.edu, so it's public at this point, whatever someone chooses to do with it, it's fine with me.
spread the word.
Yeah, that's the goal, I didn't have any desire to put this behind any paywalls or, limit access to it, so I want to see how it can inform.
So if I consult with you, maybe to make an article for the Providence Eye or something like that.
Love that.
Thanks.
Of course. Thank you so much. Guys, I also wanted to, from like the public comment side of it, first of all, I will get that report to Isabella, I guess anyone can find it, I'll make sure you guys have it. Just thank you all for inviting me here, giving me the opportunity to kind of present this data. As strange as it's gonna sound, I didn't even realize till halfway through this research that I lost a close family friend to gun violence in like 2010, so just being able to, be a part of this solution, just, thanks for having me, really do appreciate it.
So we appreciate you, Doug, and you're a friend of the community, so anytime you have anything you want to share, or obviously come and participate or whatever. Thank you, appreciate the work.
Thank you.
Last week, that's also, you guys also, thank you for coming. To all the meetings, participating, I'm just throwing July 23rd out for next meeting. Cause I realize when I don't get at least an idea out there, back up. So like say, 1 PM works for folks. Yeah, do it. What about, July 30th? So, for you? So what you like? Either one's fine, yeah. So we'll probably plan for July 30th by 1 PM for the next meeting. And yeah, if anyone has any questions or comments they wanna share, we'll get it over to everyone. That being said, I am adjourning this committee. Have a great day, stay hydrated.
Well,
Vote on it?
So.